Hi, my name is Billy Schuler, and this is my final project for CHPM 2605. I'll start off by showing you my practice management binder. So here it is, practice management. Here is the first tab, pre-visit. The second, visit 1. The third, healthcare class. The fourth, ROF or report of findings. The next one, and the last one, the progressive exam. Okay, and that is the practice management binder. When the patient comes in for their first visit, but before any actual exams or adjustments are made, the pre-visit, I would first introduce myself, introduce the patient to my staff, and just let them know what I'm going to be able to provide them, including top-of-the-line healthcare and some unique educational opportunities regarding their health. I would then have them first fill out any and all necessary paperwork with my assistant. It's not a lot of paperwork, but it is extremely important paperwork which must be read, understood, and filled out accurately for professional and legal reasons. After this, I would move on to the actual visit, or visit 1. And since this is visit 1, I would introduce them to chiropractic and explain what it is. That it is a system of medicine based on the diagnosis and manipulative treatment of misalignments of joints, especially those of the spinal column, which cause a disorder known as a subluxation, which is a vertebral misalignment that causes interference to nerve function. I would tell them that the primary clinical focus as a chiropractor, regardless of why they were coming to my office, is to correct vertebral subluxations. They may come in for many different reasons, for many different symptoms anywhere in the body, but my primary focus is to correct subluxations. I would then go on to describe the 5 components of the vertebral subluxation complex. The first, spinal kinesiology. This is hypo or hypermobility and compensation reactions. It consists of head tilt, scoliosis, loss of curves, fixations, rotational comparisons, and leg checks. The second, neuropathophysiology. This consists of graphing and pattern work. The third, myopathology, consists of looking for an area of spasticity, flaccidity, and doing muscle tests. The fourth, histopathology. This is looking for disc degeneration. The fifth, pathophysiology. These are phases of degeneration of the spine. There are 2 parts of the vertebral subluxation complex exam. These include the comprehensive exam. This relates to the spine, muscles, and nerves, and the X-ray exam. For the first visit, we'll actually be going through 3 exams. The first is the physical exam. It consists of neurological tests, orthopedic exams, including leg checks, sensory, somatomotor, and motor skill tests, and all other physical exams. The primary value is to rule stuff out. The second, the chiropractic exam, this consists of the 5 components of the vertebral subluxation complex, as mentioned earlier. And the third, the X-ray exam. Before we begin care for our new patient, we would have to receive a management by agreement, which is defined as we don't do anything to the patient until we've explained what it is, what the costs and consequences are, the visit frequency, the commitment, etc., and then get their agreement to proceed. This leads to something called clean windows, and these are the 3 agreements we must get from patients. The first, we begin care and get our recommendations, which is what we're leading up to before we can get started. Number 2, proceed with the course of condition-based care. And 3, either discontinue or continue to the next stage of care. A new patient scenario will go something like this. Hi, Oscar. I'm Dr. Schuler. It's good to have you here. What is the major reason you have consulted the office? Oscar, the patient, would then say, I'm having really bad low back pain. I would then say, Oscar, we have a lot of people who consult us for problems like that. Let me tell you what we are going to do to determine if and how we can help you. First, we are going to need a comprehensive case history. It is important that you fill out all the spaces when you do that with the staff. Second, we are going to do a physical exam. You've probably done that at a lot of doctors' offices, but it helps us rule out issues. Third, we're going to do a unique and comprehensive chiropractic exam. And unless something indicates otherwise, we will probably be doing an extra exam as well. Once we've completed these exams, I will correlate all of that information and put together what we have found. On your next visit, when you come in, we will first show you a short video presentation because we want you to understand exactly what we are looking for. And when you and I sit down and review the findings, you will be able to see exactly what we see. I will then tell you what we found, what my recommendations for care are, and what you can expect from us as far as care is concerned. It will either be here, care somewhere else if that's needed, or a combination of the two. Then at that time, you can decide as to whether or not you want to begin care. Would you like to go through the exam and report process and get my recommendation for care? Oscar would then say, hopefully, yes. And I would say, based on that, I would be willing to accept you as a patient to go through the exam and report and see how we might help you. Now we have received our management by agreement and we are ready to proceed to my exams and report of findings. After the exams are complete, the report of findings consists of 3 reports given to the patient. The first, the clinical report. This comes from the exams we performed. The second, the financial report. This goes over cost for care and payment for services rendered. The third, the office policies. This is missed appointments, children, healthcare classes, etc. The first visit is considered to be the most important visit in the office due to this reason, the report of findings. I would explain what beginning care would consist of and how treatment would eliminate their problems and cause relief. It is crucial that the patient understand their problems so they may make proper decisions regarding the direction of their health. I would explain the cause, severity, recommended care, and their prospects for correction using the assessments we conducted associated with the 5 components of the vertebral subluxation complex and the information we collected. I can explain what tests I performed, like motion and static palpation, describe their range of motion, show their x-rays, pictures, and diagrams showing how their nerves are not functioning correctly, which cause their muscles to spasm or to become weak, and how this affects the alignment of the entire back, of the vertebrae, which in turn affects the entire body and can lead to degeneration and loss of function. I will tell them what phase I consider them to be in, either serious, severe, or extreme. I can recommend them to attend the healthcare class or new patient orientation and let them know that these classes take place once a week and are just 1 hour long but full of great information where I can better explain to them what chiropractic is. In a 1 hour class, I have 15 to 20 lecture points which are typically covered. Every lecture is typically 3 to 5 minutes long, consisting of hundreds of topics that are strung together to create one full lecture. I would let them know that they always have an extra seat available if they wish to bring someone for support. I would go over my chiropractic philosophy, which influences the type of care I provide my patients. The primary goal of the healthcare class would be patient education. If my patients do not understand what I understand, then they cannot make the proper decisions about the care they are receiving. This is less about education and more of a reorientation of the review of me and what I have to offer them. I would talk to them about my staff and how they are in line with everything I stand for and that they greatly help the process and are very trustworthy. At the end of class, I would have them sign up for care if they wished. This is called the fire drill, and this is the actual mechanic of someone signing up for class at the end of class. It is called the fire drill because it is a drill in the best way we can save your life through chiropractic care. Explaining office policies, I would explain to them the cancellation notice, which is a 24-hour window to cancel their appointment and 1 free pass because things can always come up, and that there needs to be a commitment from both sides in order for this to work. They can either pay monthly and receive a discount, or they can pay per visit and pay a flat rate. The management by agreement decision made by the patient at the conclusion of the progressive report of findings would be me asking, based on our recommendations for care, are you ready to begin chiropractic care? At that time, the patient either says, yes, they are, or no, they are not. During the new patient orientation, I could connect better to the audience by using things called connectors. Connectors are public speaking skills that allow me to connect relatively unrelated subjects and make them sound like they have something to do with one another. The most common connector is, in order to understand what X is, I first need you to understand something about Y, or something along those lines. This brings 2 completely separate things together and allows the audience to understand, or the new patients to understand, something that they previously were not able to understand before. The next phase would be the progressive report. This takes place after we finish with the treatments of their current symptoms. I would reassess them, and this would let them know what kind of progress they are making, and I would compare their initial findings to their current findings. This would conclude initial care, and I would leave the patient with the decision of whether or not they wish to continue care. If they decide to continue care, they have a couple of options on what type of patient they are to become and the type of treatment they are ultimately seeking, of which there are 3. The first is condition-based care, to reduce or eliminate the symptom or disease. People who come for this are people who have aches, pain, diseases, infirmary, and are looking for that to be reduced or eliminated. This is patient-based care, even though chiropractors do not treat conditions. The second is corrective-based care, to enhance function, primarily neurological function. The patients do not usually have symptoms, but are looking to get their spine and nervous system working at the optimal level. The third, wellness development care, to ensure optimal development at each stage of development at each stage of their lifetime. This care should begin at birth, even if it's not for this patient. We are our nervous system, and this type of care is to ensure and maintain the optimal level of our nervous system. Eventually, on visit 10, some practice options that I will give patients in my practice to be used to introduce their friends to my practice will be to include a referral section on the feedback form that asks them how they think their care is going and how the staff is treating them. It will include the actual referral section. The patient writes down a name of people they think can be helped through chiropractic care. I would write this statement: to keep our costs for healthcare low, we do not spend a lot of money marketing our office or marketing chiropractic, and we do not have a pharmaceutical company that does the marketing for us. Therefore, our practice is based on referrals, and at times referrals to other doctors. Another option is before the 10th visit, have the staff send the patient home on the 9th visit when they are checking out with the form, and tell them to fill it out at home to bring it back on their 10th visit. This gives them time to think about who they can write down as a name. When the patient brings the form back up to the desk after filling it out and there are no names filled in, have the staff return the form to the patient and tell them that they forgot to fill out one of the sections. Ask open-ended questions to the patient about the person they have referred. It could be as simple as, what is going on with John? Then ask, what would it take for John to understand what you and I understand about chiropractic so they can get help with that? Another is, give the patient a list of things that other patients have done to get their friends into chiropractic care. You could bring them to a healthcare class, bring them with you to one of your regular visits, give them the CD that we offer that explains chiropractic, etc. Ask them which of these things would be best for John. And then the last thing is follow up. I could also let the patient know that the healthcare class or new patient orientation is just one of many events that I hold in order to reach out to the community and to people they may know. The other ways that their friends might be able to learn about chiropractic from me are through 4 routes. The first, internal procedures. Those consist of the healthcare class and the 10th visit that I've discussed earlier. The second, internal special events, and I would have these 4 times per year. It is less about what I'm doing and more about the fact that I'm focused on getting new patients that attracts them to my office. I can always have things going on with new patients, and there are hundreds of examples of these events. The third, external procedures. These activities are scheduled, like local screenings at the mall. These are not always about getting new patients, and my Facebook page would fall into this category. The fourth and final would be external special events. This could be a health fair in town that I rent a booth at and do spinal screenings at. And now I will show you my binder consisting of my research. Okay, here is my research binder. The first tab is vertebral subluxation. The second, wellness development care. The third, new vitalistic system. The next, subluxation condition-based care. The next, chiropractic spinal. The next one, functional neurology in chiropractic. The next, current mechanic systems. And finally, bad medicine. Okay, that concludes my office visit. Thank you.